Hello, and welcome to a Health Podyssey. I'm your host, Alan Weil. The COVID 19 pandemic has made the relationship among research, policy, and public health strikingly clear. People who may have given little thought to health policy and research began following the latest study results to guide their own behavior and to push governments and businesses to make decisions that reflect a combination of science and their own values and risk tolerance. Health journals like Health Affairs responded with rapid processes and free content to meet growing consumer demand. The new environment had an effect on health services researchers as well, with a new emphasis on timeliness and attention to issues affecting the public. And it's in this context that I'm speaking today with George Wehby, the John W. Colleton Chair in the Department of Health Management and Policy at the University of Iowa School of Public Health. Dr. Wehby co-authored the most read Health Affairs article in 2020. In that paper, Dr. Wehby and co-author Weil showed the value of state-level mask mandates in the early phase of the COVID-19 pandemic. More recently, in January of 2022, Dr. Wehby and co-authors published two more papers in Health Affairs, one related to children's educational attainment and the other to racial and ethnic disparities in dental service use among lower-income adults receiving Medicaid. We'll discuss these topics and how health services research has changed during today's episode. Dr. Wehby, welcome to the program.
Thank you very much, Alan. Great to be with you.
It's such a pleasure to have a chance to talk to you. I have to start with your 2020 face mask study. Not only was this the most read paper in 2020, but it had the highest altmetric score of any paper we've published. That is a term that may not be familiar to many, but the altmetric measure is one of attention, how much attention a paper gets. And your paper was just off the charts. So it was a great victory for us, but of course reflects primarily your effort. So I'd like you to take us back to that time. Tell us, how did you identify this as a subject of study? How did you pull it together so quickly at the beginning of the pandemic? Just give us a sense of what was going through your mind at the time.
Yeah, so we were living through the pandemic, the beginning of it at that time, and being health policy researchers, we were naturally attracted to consider and look at policies that were at that time being, put forward by states, by different, authorities and governments. And the mask mandates was particularly interesting to us because there was a bit of a kind of uncertainty about it in the beginning, especially, and some kind of controversy about the effectiveness and whether it should be mandated or not and such. And so we had been reading the literature and the news about this topic, and it caught our attention that there had been increasing calls to look beyond just the lab-based studies and the clinical studies that had been done up to that time and on different diseases. Not most of them weren't really COVID related. So we were, following the policy changes and realized that there had already been some change at the state level with some of these mandates, and kind of a few weeks had passed, so we didn't have a very long window to really look at this. I have to give a lot of credit to my co-author Weil about this. We work really great together as a team, and he deserves a lot of credit on this work. And so some of our discussions was, that this is a respiratory disease. It kind of deserves, a more kind of, I think, robust look at masks and kind of the natural, the real world, the policy, world. So we started the work. The data to kind of to a large extent was available. It took a lot of hard work and I'll say several overnights to really be able to pull it together that quickly. But yeah, were satisfied with how it came out.
I want to focus on a couple of aspects here. So, first of all, a pandemic comes, and most people think about clinical medicine. They think about the disease and the treatment of the disease. Um, Here, you're talking about a public health measure. So, give us a sense of how you think differently about looking at something, a policy that's applied to the population, distinctly from sort of the science, if you will, of the disease and its transmission?
Yeah, that's a really good question. The context of the policy is that you are trying to find an effect that is kind of the average effect. Like it's kind of been, shaped by a lot of different behaviors in the population, and you really can't measure all of those individually, at least not in the data that we had. So we're trying to kind of find, all the possible effects, all kind of summed into one estimate, if you like. But it's really a highly relevant estimate at the end of the day because it's telling us, on average, what has this policy in that window that we investigated, what has it done to this measure of COVID transmission? And so you're right. I mean, it's a policy examination, but there are also lots of other variables happening that kind of always make such evaluations interesting but also challenging. And so you kind of have to consider as many of these other policies as you can while you're studying that sort of question.
You sort of anticipated my second question, which is, with the data you have, particularly that early, there's so many questions you can't answer. So you put in a mask mandate, and there are compliance issues. There's the effectiveness of the mask. There's how long it takes to show an effect, and you can't really measure the what's happening inside the black box of the mandate. You're just looking at sort of the beginning point and the end point, and intellectually, maybe that doesn't seem very satisfying, but in fact, it is the real world where we often don't know why something works, but we have to figure out if it does. So, how did you conceptualize what endpoint you felt like you could measure, even though there were mechanisms here that you couldn't?
Right. The end point was kind of the one that was at that point most policy relevant, which is, are there changes in the growth rate of COVID, the daily growth rates in that particular phase of the pandemic? And what we kind of measured is, to use a bit of jargon, is kind of like the intent to treat policy. Like, on average, was there an effect? But you're right. There are a lot of things in the black box, and some studies, several studies came out later that found associations between mask mandates and compliance. It's still, debatable, and every day there's kind of new talk about what type of mask is most effective and such. So I agree. I mean, there's going to be a lot of, I think, questions following this, but I think all of that kind of put together in this kind of endpoint, was there an effect on this endpoint? And so we try to, at least to get to that effect, account for as many of the things that we could measure at that time, like some of the shelter in place orders, the school closures, essential business closures, emergency declarations, quarantine policies, and things like that. So you kind of try what you can, but recognizing at the end that yes, there is still some uncertainty about how this effect is shaping up, and possibly also some confounding still at play. I mean, you can never rule these things out.
So, I'm not going to walk through all of your scholarship, but I do want to go through a few different studies, particularly ones you've published with us, because they get at the breadth of your interest. Just in January, we published a paper on the educational effects of the coverage expansions associated with the Affordable Care Act. This is a totally different topic than mask mandates. Tell me a little bit about what the paper found and what drew you to this subject.
So this study looked at whether there are any effects from the Affordable Care Act expansions that began in 2014. So primarily the Medicaid expansions and the establishment of the marketplaces, whether there are any effects on children's academic achievement. And so the kind of the conceptual links are that the Medicaid expansions have brought financial security to households, that they've improved access to health care, and some evidence on improvement in parental health, and even some spillover effects on children's take up of coverage, even though children were already covered at higher rates, but because of these kind of welcome mat effects on households. And so there is a literature, of course, a vast literature on effects of income changes in low income households and on children's academic achievement. but there is less evidence on the role of insurance, and insurance not just for children themselves, but for members of the household. And so the Affordable Care Act presented this opportunity to look at this question. The study evaluated changes in school test scores in Iowa, looking pretty much at the population of students in Iowa, focused on households that are more likely to be low income through a measure of parental education we had in the data. And so what we found, and so we had two measures of test scores, one for math, one for reading. We found that the expansions were associated with improvement in reading scores after about 2 years had passed. So in the last 2 years of our evaluation, which went through school years 2017 and 2018, we didn't find this evidence for math. This kind of was generally consistent with a couple other studies that have looked at this question in other contexts as well. What drew me to it is, I've always been interested in children's health and children's development as kind of an outcome. I've done several studies on children in kind of that research area. And I've also been doing work on the Affordable Care Act, primarily the Medicaid expansions, looking at changes in access and health outcomes and such. At the same time, I've also actually looked at some of the income changing policies like the minimum wage and children's health. So I found like this to be an intersection, to be honest, between these different topics, and kind of felt like really drawn to pursue this topic.
In some small way, a commonality with the COVID work is that the mechanism here is complex and very difficult to measure. You suggested some hypotheses about why insurance coverage expansion would improve academic achievement, but you couldn't measure those intermediate steps. But you made very good use of state level data to look at an outcome that's of great interest. So that, I suppose, in some respects, reflects a similar approach to the mask mandate, where you're trying to understand the overall effect of a policy, even if the precise way that it works is difficult to measure.
You're right. And in this particular case, kind of the evidence on the mechanisms is kind of put forward in pieces, though, by previous studies. So, like I said, there is already evidence of increased financial security in households. There's already evidence of that having an effect on, children's outcomes, children's health, children's achievement. So these pieces of the mechanisms, I think, are supported, and we know much more about them in this literature than in like the mask study in that particular case. But yeah, ideally, like you would want to be able to measure and test these mechanisms in the same data set that you're examining. In many cases, that tends not to be the case, unfortunately, just because of data issues.
But that's a great point that when you can't measure the mechanism, having an evidence base that gives the mechanism face validity is really a good starting point. You're not just looking for a data match; you're looking for something consistent with a hypothesis, even if you can't demonstrate the mechanism within your own data set. Well, this is it's great to get introduced to these couple of studies. We're going to talk about some of your other work and how your approach to health services research has changed. We'll do that after we take a short break.
Racism is a fundamental cause of health disparities for racial and ethnic minority groups. And yet, racism, especially structural racism, remains understudied in healthcare research. The February issue of Health Affairs focuses on racism in health and will cover topics such as how racism damages health, measuring the health impacts of structural racism, and racial bias in digital health. Check the show notes to order your copy today.
And we're back. I'm speaking with Dr. George Wehby about his health services research in the wake of the COVID-19 pandemic. Before the break, we talked about a couple of areas of his research. I do want to bring up one more before we open up to some broader questions about changes in how you have approached your research. You've published extensively on health policy in South America, not in health affairs, but I see it on your CV. Tell us a little bit about your interests there and what are the most critical health policy topics that you're looking at in South America?
Yeah, my interest started really when I was a doctoral student. My dissertation was based on examining use of prenatal care in South American countries and effects of that on infant health. And so I kept these collaborations and they grew in many ways. My interest and my work has focused actually a lot on kind of some of the disparities in health outcomes, infant health outcomes, and use of services and insurance in South American countries. There's really a lot of opportunity, I think, to examine health policy and more broadly, actually, public policy and economic policy in South America, particularly social determinants of health. Of course, health insurance is very critical, and there's a lot of differences and variations in how it's designed and also delivery of healthcare across South American countries. Uh, but that also kind of is only one piece of really what goes into influencing people's health and well-being, particularly there because of sometimes vast inequities and inequalities in social and economic resources and opportunities. So I'm right now my work has kind of moved to focus more on these kind of public policy influences on health. I'm collaborating with researchers from Colombia on the minimum wage, the role of the minimum wage as a kind of a policy, its effects on children's health, and we're going to look at broader effects on population health as well.
Well, you've described a very broad range of interests, and your scholarship reaches into all of those areas. Um, how would you tell me what the inspiration is for the focus that you have? How did you come to these areas of focus?
Yeah, I mean, as a researcher in health policy, health economics, healthcare outcomes, it's kind of difficult sometimes to not consider all of these kinds of influences. Of course, not in the same paper, but you recognize, let's say you research insurance in one or two papers, and you recognize again that that's only one path and sometimes a small path to looking and influencing at the outcomes that you're interested in. So naturally you begin to consider what other policies or what other pathways or what other issues can my research address. And so I've always been open to this kind of multiplicity of research ideas and pathways that you could pursue. And fortunately, in many cases, you could use the same data sets that you work on. So there is a little commonality in terms of the data that you are using, and that kind of facilitates sometimes considering multiple research questions. But I've kind of always been interested in covering as much as I can, given my training, my experience with methods and knowledge of the literature, to cover as many of these different pathways as possible that lead to the health outcomes that I'm interested in.
So it's very interesting. I speak to a lot of people who work with a data set and they get some answers out of it and it gets them really intrigued in the data and they try to go deeper and deeper into what they can get from that one or set of data sets. And you're describing a somewhat different process where you answer a question and it leads to additional questions that require you to go elsewhere and to explore new sources of information so that you can answer those questions. And then in order to answer the ones that arise from there, you continue to build outward as opposed to just going deeper into one area. And both of them are very valid ways to expand your research. But it's just interesting to hear the way you characterize that. You've also, in the papers we've published, employed a variety of methods, and I was really drawn to the educational study because you're looking at an educational outcome, and of course, in a journal like Health Affairs, we're usually looking at healthcare outcomes. You also could only do it in one state because of the nature of the data, and some people might question. how generalizable it is, but it's also the sort of study that really can't be done on a national basis. Can you talk just a little more about your choice of data and particularly methods on that paper and maybe others if you'd like to as well?
Yeah, so I think a broader point, the method's choice is kind of driven by the question, and then of course it's influenced by the data that is available. In this particular case, there was clearly a need to try to put something kind of closer to the causal inference world. Like I wouldn't say like this is 100% like the full effect that applies to everyone, right? I mean, there is uncertainty still in the results, but the idea was to go a little bit beyond just like a correlation or just looking at like these two just in a kind of a simple basic analysis. And so the study takes advantage of the kind of extensive variation in the uninsured rate across geographic areas, counties in this case, in Iowa before these expansions of the Affordable Care Act. And so the idea is that there would be a larger effect of these expansions in areas that had more to benefit because they had higher uninsured rates before the expansions. And so I'll also note that this kind of design had already been done before with studies in Massachusetts, for example, with their initial healthcare reform before the ACA and in other settings as well. So it does offer an opportunity to kind of say something and about the effect after controlling for a lot of the time events that are shared across these areas. And so you're right, in this particular case, kind of external validity, the generalizability of results might be weakened, of course, by using one state, particularly because the sample, the diversity of the sample isn't necessarily representative of the larger, population or of other states. But I think we have, evidence that I think could point to effects that might apply in other settings. Like there isn't something, on the surface that suggests like this effect is only specific to this state and shouldn't like generalize some other places. So in kind of my research overall, I try when I can to kind of account for confounding and get closer to this kind of causal estimate, again recognizing that there are still threats in any such analysis. You just try to kind of weed it out as much as you can and understand what effects it might have on the results.
We've talked a lot about research you've published. I wonder if you could tell us a little about what you're working on now.
Yeah, so I am working on actually kind of one area that I've been working on getting the data set up for that for a while. It's really interplays between children's health and their academic achievement, and that kind of relates a little bit to the paper we've been talking about on insurance. But this is more trying to get at particular changes in access to health services, including dental care among children early in their life. How does that relate to long-term outcomes like academic achievement? So I've been, working on linkages of different data sets, Medicaid data, birth certificates, and educational test data to try to answer some of these questions. So that's one particular area that I'm working on. I still have work on these income support policies like the minimum wage, looking at effects on children, and still some studies happening on the Affordable Care Act as well.
I think when a lot of people go into health services research, they hope that they'll affect public policy and improve it and improve population health. You have done that through your work. And for someone who's trying to learn from what you've done, what would you tell them? What advice would you give them around whether it's topical areas or you're working with the media as your paper became uh, widely known? What would you say?
Yeah, so I think one thing that I'll probably start with is choosing the idea, and of course people choose their research ideas in different ways. But one thing that I'll say is don't be afraid to go after the harder ideas sometimes, the higher impact idea. the one that might seem like, more policy relevant, more impactful, and has more significance, even though it might require perhaps a little bit more challenges in, data access, or framing the design, and so on. Spend quite a bit of time thinking about the research question before jumping into the analysis and the data work. And the other thing is, of course, like, read a lot the literature, the news, just the daily news focused on health and health policy, because a lot of ideas come from there. And just be humble about your findings and about your work, because we all know that in all kinds of research, particularly social science research, there is still more of the uncertainties that we opened with, talking about. And just kind of be really transparent and just clear about what your results say and what they don't say. And yeah, just be open to criticism and pushing back. And that's how we improve research and science going forward.
Well, those are such great pieces of advice. I think we should wrap it here, because I don't know that there's more that you could say. I appreciate the advice around humility. But as we close, I just have to ask, what did it feel like as the attention to the face mask paper grew and there were more inquiries about its findings? What was your reaction at that point?
Yeah, I think it was a mix of excitement and, kind of a feeling of, having done something relevant that people are paying attention to, and perhaps they're finding it useful. At the same time, it was stressful a little bit, yeah, to get, kind of a lot of attention and news requests and such. But I think, I approached it with that kind of feeling that I spoke about, just being really transparent, and I think that helped. And I think that's kind of my general approach with this kind of attention. But yeah, it was overwhelming a little bit at the beginning.
Well, Dr. Wehby, thank you for the work you've done, the opportunity for us at Health Affairs to publish your work, and for being my guest today on A Health Podyssey.
Thank you very much, Alan. It was great speaking with you.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about A Health Podyssey.
Health Podyssey is produced by Health Affairs, the leading journal for health policy research. The team behind the show includes Patty Sweet, Jeff Byers, Julia Vivolo, Sarah Kolk, and Sue Ducat. Like the show? Subscribe to A Health Podyssey on Apple Podcast, Spotify, Stitcher, Google, or wherever you listen to your favorite podcasts. Thanks for listening, and have a great morning, day, or evening.